Last year, the International Organisation for Migration actually attended the needs of 5.2 million people.
Even though access to healthcare is a basic human right, because the growing numbers of migrants and refugees, it's becoming increasingly difficult to provide that healthcare on the ground.
Realising the pressure that IOM were under, Frontend volunteered to conceptualise a future vision for migrant healthcare.
Earlier this year, we approached the top design colleges, and what we wanted to do was to conceptualise ideas and come up with solutions for the challenges that the IOM were facing.
It's one thing to read about it, but when you have a person you can actually just picture in your head, it changes just from an international problem to kind of a human problem. Empathy is a big thing in the design process. It's what's their current situation and what makes them want to use it. So the research part is the start of the discovery, the journey.
One of the main issues that we've come across is that a migrant might arrive and get tested for an illness of some sort, but not be around long enough to get the results.
As patients move around, their healthcare records often get duplicated. So we looked at a cloud-based solution that would allow you to store their records electronically. As they move to a new station, they could access their records and their test results in their own language, and hopefully this would encourage ill patients to get the tests in the first place. We could use remote video calling to provide healthcare directly to people on the ground. It would be good to get healthcare in your own language from a native or someone close to where you're from, but also it would allow those healthcare professionals who are often very, very busy, but concerned as well, to give a service or give something back, but without interfering with their jobs.
One obvious area that was in need of improvement was medication labelling.
Well, typically what happens is there's handwritten labels and they're stuck on Ziploc bags. Obviously this is inconsistent, it can cause confusion, so there was a limited amount of information on the labels in the first place. So what we did was we worked with the IOM and we identified a potential solution for creating a standardised labelling system that aid workers can put onto the Ziploc bags themselves. We looked at important information on medication and we convey that graphically and make sure that more people understood the key messages that were on those labels.
This collaboration has really come in at an opportune time in that we're now able to see how we can continue with providing healthcare to people who need it most. The potential is huge. I would propose certainly, once it's ready, actually testing it out and rolling it out as a pilot.
We hope that it will help everybody who's dealing with these crises lives much easier. Good design and human-centred design can make a huge impact.